There are more than 7.5 million people currently waiting for NHS treatment. 3.19 million of those have been waiting for more than 18 weeks, and for 282,000 of them, it's been over a year. Over a third of Brits report delaying medical care due to fears over shortages and wait times. That's completely unacceptable and a failure by any reasonable standard. But the problems of the NHS run much deeper than surface level statistics. Life expectancy in the UK has been declining for the last 4 years. That's partly due to the pandemic, but the trend started before COVID. Our public health in general is terrible and getting worse. Over a quarter of Brits are now classified as obese, and there's a 17-year discrepancy in life expectancy between Britain's poorest communities and its wealthiest. What's going on here? Why is the NHS and our public health in general performing so terribly? And is there a way to solve the problem of this massive NHS backlog? For some, there's a pretty simple explanation: Tory cuts. That's partly the case, but as we'll see over the course of this video, the true causes are nowhere near that simple. Let's start with the obvious misconception, this idea that the Conservatives cut the NHS budget. It's simply not true. Over their tenure from 2010 to 2024, the Tories increased the NHS budget by £48.6 billion. But the fact that the Tories increased the NHS budget doesn't absolve them of responsibility for running the NHS into the ground. That £48.6 billion represents an average annual increase of 1.4%, much lower than the 5.5% annual average increase in NHS spending under the previous Labour government. But why isn't 1.4% enough? The obvious answer is inflation. Over the same time period, inflation increased by an annual average of 2.68%. So in real terms, the NHS budget is smaller than it used to be. If you look at the types of products the NHS buys, the cost of providing healthcare has gone up much faster than inflation. Prescription medicines have increased by 3.5% annually, staff costs have increased by 3 to 4% each year, and energy costs grew by a whopping 7 to 10% a year. We're also older than we used to be, with 40% more Brits over the age of 65 than in 2000. An aging population means more medical care. By the time people are over 65, the majority will have one long-term medical condition. By 85, that proportion jumps to over 80%. Over 70% of the NHS's budget goes to providing care for long-term conditions. Also, paradoxically, better healthcare has been worse for NHS finances. We have more medicines and devices and tests for more ailments than we used to. Those shiny new medicines are amazing, but they are an expense the NHS didn't have when there was nothing to offer people with a lot of conditions. Over the past decade, NHS spending on drugs for specialised services has grown at 8.9% per year, while for devices it has increased at 10.2% annually. So the heart of the problem is that healthcare is much, much more expensive than it used to be, and it's going to keep getting worse. A lot of politicians say that AI and reforms will fix this problem without an increase in spending. Charitably, that's a politically motivated fantasy. Realistically, it's a bit of a fib that makes the Labour Party more electable. Funding is the core issue, but it's not the only issue. A lot of choices that the Tory government made a bad situation much worse. For example, in the middle of the pandemic, when there was a massive shortage of almost all medical resources, the Tories decided it was a great time to completely restructure the NHS. They abolished the country's primary public healthcare organisation, Public Health England. This was on top of the fact that 25% of our public health funding had been slashed since 2015. And the legacy of COVID is still contributing to NHS wait times. In 2022, there was an average of 9,200 patients with COVID-19 in English hospitals every day. Accounting for this, the NHS had 1 to 5% fewer beds than it had pre-pandemic. And with very limited resources, increases in the capacity of the healthcare system to help deal with that additional burden. Tory restructuring and cost saving included the creation of 300 new NHS organisations in a short 5-year span from 2010 to 2015, which cost a lot of money, created a lot of bureaucracy, and clearly did not solve the NHS's problems. On top of meddling fruitlessly with the NHS, Tory cuts in other areas of public spending placed a massive additional burden on the NHS. Take social care, for example, for the elderly or at-risk patients. Cuts to government-funded social care and social carer wages mean that there is a shortfall of over 152,000 social care workers in the UK. As a result, there are 11,000 patients in English hospitals every day who are ready to go home but can't be discharged because there's nowhere for them to go. To be clear, they do not need medical care, they just can't safely go home, and they're taking up 11,000 beds. Of that number, over 3,600 of those patients have been in hospital beds unnecessarily for over 3 weeks. Another example of this, another result of inadequate funding, is that maintenance and basic machine replacements have in effect been abandoned completely. The money that should have been used to repair deteriorating hospitals is instead pilfered to cover basic running expenses and provide emergency care. The result is that there is a backlog of maintenance that amounts to £11.6 billion in the NHS. Doctors report being unable to replace crucial equipment like MRI scanners, reducing the amount of procedures that can be carried out every day. And that's to say nothing of the digital automation or tech improvements that are supposed to make the NHS more efficient, but there just isn't money available to spend on those long-term investments because in the short term, there's such a significant burden on the healthcare system. What's more, Tory policies means that hospitals can't make these purchases even if they have the money. HM Treasury imposes strict limits on NHS trust investments, even when those trusts have the money and the people running it know they need new equipment. As resources became more scarce, they've been prioritized towards the most essential and pressing part of the service, emergency care. That means that preventative care, GPs, and other types of medical services have been defunded. For example, while the number of hospital doctors has risen dramatically over the last decade, the number of GPs has, if anything, slightly declined. This is a problem because patients who cannot access a GP may later need more expensive medical care because they could not catch problems early. Or patients end up using the A&E effectively as a GP, further burdening hospitals. The cherry on top of all of this is that in addition to all of the funding issues, we just don't have enough doctors and nurses. In England alone, excluding general practice, there are almost 90,000 NHS vacancies, including 36,000 nursing vacancies. 11,319 doctors left the profession in 2022, a 20% increase on the previous year. Working for the NHS is pretty thankless. An extremely high percentage of doctors and nurses report needing to work far beyond their required hours. The experience of working in hospitals is that there's an endless list of patients who need crucial care fast, and that list is growing faster than you're able to treat them. All of this, frankly, is a disaster. And it means politicians have a difficult choice. Either accept that we can no longer provide the standard of care that we used to the same number of people, or dramatically increase the NHS public funding and keep putting that funding up year after year. And I do want to point out, because this has been a pretty negative video because the situation in the NHS is so dire, but I do want to point out that simply privatizing the NHS wouldn't solve this problem. Healthcare costs will continue to go up regardless of whether they are paid by the government through taxes or by us as private citizens. The US, for example, has a very similar problem. While we spend about 10% of our GDP on healthcare, primarily through the NHS, the US spends 17% of its GDP primarily through private insurance. We're going to have to pay for the cost of rising healthcare either way. The key difference is when the NHS is funded publicly, those decisions fall at the feet of politicians who often have a difficult time justifying the tax increases that really are necessary to stop the NHS from collapsing completely. I think the NHS is an extremely important public institution in the UK. I think it's critical that we provide healthcare free at the point of use. But you need to be able to fund a system, and you have to be willing to make the difficult political choices needed to raise taxes so that money can be invested into the NHS. Otherwise, the system is just going to steadily get worse year after year. Waitlists will get longer and longer, and public faith in the system will continue to deteriorate.